Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. Now, we've got another example of one of those things where Scotland has to be different just to be different from England. And again, this may well cost lives, but that, of course, is unimportant. The difference must be maintained. And we're talking here about strokes, and these are absolutely awful things. I'm sure many of the viewers here will know someone who has been afflicted by such a terrible thing. I myself had a friend. He was a plumber friend of mine. He was 56, I think, 55 years of age, something like that. Had a massive stroke and was basically, for the rest of his life now, he's going to be bedbound. 30 years he's going to spend, probably, lying in a bed, can't speak, can't move, mind fully working, but just, unable to deal with anything. Horrific. And, of course, the main thing you can do when someone has a stroke is to act fast. And of course they have this acronym of FAST: face, arms, speech, time. And of course it's get someone, recognise what's happened and get them treatment quickly, and it can save a lot of function. Now they're trying to update it, and they're updating it in England to be fast, which is balance, eyes, face, arms, speech, time. Be fast being the acronym now. But just to be different, Scotland are refusing to change. Who knows why? Let's have a look. So, anger as the SNP minister rules out updating vital stroke advice to replace what is ineffective fast. Jenny Minto said the Scottish Government had no plans to deviate from the acronym despite calls for it to expand to be fast. So why? Even though it seems to be better, it's a better, more memorable thing. Be fast, breathe, balance, eyes, face, these sort of things. These are the things you look for if someone's had a stroke. Are they wobbling? The eyes, are they in the head, rolling in the head? Is the face sloping? It's a simple change. It's a tiny, tiny change. But because England have done it, Jenny Minto said, no, we can't be the same as England. We have to be different. So we have to be less effective in the treatment and recognition of a very, very serious condition. An SNP minister has come under fire after she refused to update a campaign to highlight the symptoms of a stroke. Jenny Minto, the Minister for Public Health and Women's Health, said there were no plans to deviate from the FAST advice, despite evidence suggesting it can miss up to 40% of strokes. The FAST acronym stands for Face, Arms, Speech, Time, and aims to educate the public on how to spot a stroke. It highlights potential dropping of the mouth on the face, arm weakness, slurred speech, and while encouraging people not to delay seeking medical advice in time. And on that, can I just say, if ever you have long-term tingling in the end of your fingers, go and see a doctor. Absolutely see a doctor and monitor your health, monitor your blood pressure. These are very, very important. However, calls have been made to change the acronym to be fast after a study stated it identified more ischemic strokes than the FAST test. The BE stands for balance and eyes, with the change championed by Scottish Conservative councillor James Bundy, who lost his father Tony to a stroke. The Falkirk representative said while FAST had done immense good in raising public knowledge to stroke symptoms, it falls short of saving lives when strokes manifest differently, especially TIAs, for example. Tory MSP Stephen Kerr has now called on the government to reconsider after Miss Minto ruled out a change in a letter to the Citizens Participation and Petitions Committee in Holyrood. You have to ask, why is she against changing it? They're changing it in England, so it can't say it's just because England are adopting this, they're refusing to. When that balance and eyes thing can save a further 40% of stroke victims. It seems almost inhuman. He said, I am shocked and disappointed to read that the Scottish Government is refusing to listen to independent research and expand the stroke public health awareness campaign to incorporate more symptoms of stroke. And since his father's premature death following a stroke, which was not detected by the FAST test, He said, my friend and colleague, Councillor James Bundy, and his family have highlighted the ineffectiveness of the FAST test. He said, and by examining international examples and independent academic research, the Bundys have provided an alternative solution which would improve the effectiveness of this test and save lives. And even if it isn't saving a life, I mean, beyond saving a life, it can save functionality, it can save memory, speech, all sorts of things it can save. It is very, very important. But Minto, just to be different, refuses for some reason in her mind to become the same, elsewhere. Why won't she change? What is the reasoning? She must be made to explain why she won't change the advice. Is it because the printing costs of putting the other two letters on would be so, hideously high? Who knows? Anyway, he said, despite this, the Scottish Government remains reluctant to make this common sense change. How many more lives need to be lost before the Scottish Government wake up and see the value in Be Fast? Again, you've got to ask why. Anyway, Councillor Bundy lodged a petition with the Scottish Parliament in September last year. The committee wrote to Miss Minto in December, but in her response she confirmed, we do not currently plan to deviate from supporting the use of the word fast. And why? Why? There is no reason for this except she doesn't want to be the same as everyone else. Scotland has to be different. While the situation will be kept under review, she said the government would consider how awareness of the less common symptoms of stroke can be increased. Hey, how about this? Be fast. She added, the 2023 edition of the National Clinical Guidance for Stroke states that more research into improving public awareness and appropriate action upon suspecting a stroke is needed. Just because more is needed doesn't mean you can't promote what is already known. If you are waiting until everything is known, you will do nothing. It must be stepwise. Increase awareness piecemeal, but still increase awareness. Why would you wait? You know something's there now. Why not push it out now? Unless there is alternate reasons. And there absolutely must be. Otherwise you'd do it. Regarding pre-hospital identification of stroke, the guideline also states that further evidence is required before a recommendation regarding the use of other screening tools that screen for non-fast stroke systems could be made. She's hiding behind bullshit. Balance and eyes. It's simple. But that's what we've got. You've now got a government in the form of Jenny Minto deliberately denying that these symptoms exist when 40% of stroke, 40% would not be picked up by the fast method. There is something broken inside that woman that she would deliberately make this choice to hide this from people. That she would deliberately make the choice to not let people know that these symptoms are real. And the bullshit she's giving, oh, well, we haven't fully studied it yet. Fine, fully study it. And in 2-3 years' time, change the wording again. But there's no reason not to change it now, unless one, you deliberately want more people to have a stroke, or two, you just want to deliberately be different from England. But then she looks like someone who's rather inhumane. She doesn't look normal, does she? She looks a bit simple. She looks like she's not fully developed. Anyway, I shall stop there and come up and leave that stupid, evil, inhumane woman to keep her counsel. But I will ask the rest of you to remember, be fast and tell people, be fast. Balance eyes, face, arms, speech and time. Thank you very much. I will come up. So why would Jenny Minto decide in her head that be fast is not a good thing? What makes her think that not telling people, not informing people of other things is something that she needs to keep a secret? Let's not tell people this. Rather than push it out, let people know, let people be aware. No, we've got to keep it a secret. Is it because if more people, discovered that someone had had a stroke, it may mean more people were saved, which means more people would need to be treated? That means more people into the NHS, and they know they cannot afford to treat people. After all, they've massively underfunded the NHS If there's more patients, it makes it look even worse. And she is the Minister for Public Health. You've got a Minister for Public Health who doesn't want to tell the public how to be healthy. Typical of the SNP, isn't it? Mind you, you've got an Education Secretary who's illiterate. You've got a Transport Secretary who doesn't know how to run a train system. You have a health Secretary who is overseeing the worst hospital waiting times in history. It's everything. You have the Finance Secretary who can't count. So why should a Public Health Secretary or Public Health Minister care about public health? Anyway, I shall stop there. Thank you very much for watching. Do please hit the subscribe button, ring the bell, leave a like, leave a comment. Please share the video. And until next time, stay safe, stay well, and I will speak to you later. Bye.